Our entire viewing area is still in the CDC's low community COVID level, which is good news. But doctors say that testing plays an even more important role now that we're all moving out and about more freely and people who have had Omicron are being reinfected. Testing for COVID has shifted throughout the pandemic. While there are fewer testing sites open, at-home tests are readily available at no cost.
This is far easier for us to know who's sick and manage who's sick and self-manage if you get sick than where we were a year ago.
Testing requirements for people traveling internationally are still in place. Airlines for America, representing major U.S. airlines, is hoping to change that, urging the federal government to remove the requirements for vaccinated travelers. In a statement, the organization said the policies, quote, harm our nation's economy and hinder air travel to the U.S.
The reasons those tests ahead of, say, returning to the US international flights were put in place were to try and minimize the importation of new variants from other countries. And that is largely an ineffective strategy.
Dr. Cameron Wolf, an infectious disease specialist at Duke Health, says that doesn't mean testing isn't important.
There are health implications in taking those rules away. There's clearly logistic advantages in doing so from the airline's point of view. But if they were to go away, I think people need to be very responsible.
Doctors suggest stocking up on those at-home tests, but warn there is a greater chance for a false negative. They say if you're having symptoms and test negative, that you should take another within 12 to 24 hours. In Uptown, Chloe Leshner, WCNC Charlotte.